Okay, so let's start with your skincare questions and then we can just go from there. Any recommendations on the Sephora haul? So, okay, so at Sephora, I know you guys are not going to want to hear this, but the penetration rate for the skin is very, very limited. So, if you're already buying something that has a low percentage and they don't have a proper delivery system to get that active ingredient past the skin's barrier, and now you have to remember there's different layers, right? So every layer it gets absorbed into, it dilutes. So the higher penetration or the higher amount of ingredient, and that doesn't necessarily mean percentage, it's how the delivery system is. And that's why there's peptides. So peptides help deliver them into the skin. That's what you're going to need. I would look into, I don't even know what Sephora sells, but, and it depends on your skin. You got to get your pH right. So, you might want to look at more of the clinical skincare line. If you think that most drugstore skincare is going to give you the results that you need. Now, if you're younger and you have you can get away with some of the retinol products if you can use retinol, like the Olay stuff and things like that. But if you are older and you already have existing deeper fine lines and wrinkles, it can only do so much, right? So I know that's not a popular thing, but I've treated like thousands and thousands of people. Okay, so someone had mentioned something about the Korean skincare line, and Korean skincare line is just like any other skincare line. You've got your good ones and you've got your bad ones, and so you have to look like there was a company that wanted me to promote a lot of their really inexpensive Korean masks, those sheet masks that were like $3.50, and then for on sale you get it for like $1.25. And then I looked at the ingredients and it was like just a bunch of like fillers and alcohol and fragrance. So you have to look at your ingredients. I use a hyaluronic acid serum every morning. So, or do I need to do something like petroleum? Or can I top with light moisturizer? Yes, you can, but it also depends on your skin type and where you live and what you're topping it off with. Because if it's a light moisturizer that has very little occlusive agents and it's just humectants and you live in a dry climate, then it's not able to keep that moisture on top of the skin. So what should I layer first? Retinol serum and hyaluronic acid, niacinimide and vitamin C. Are they both water-based? Water-based serums always go on first, but if you are using something that is an active ingredient like retinol or vitamin C, depending on what it's paired with, that always needs to go on first. And you can even alternate it if you want to. I keep missing these. Yes, thin to thick. What's your opinion of the ordinary skincare? You know, the ordinary skincare is actually good, but this is the biggest. So this is what's happening. The ordinary is trying to do its best to try to advise the common person, the general public, on how to use it correctly. But what I'm finding is when I have a skin consultation that is using all these serums and peptides and actives of ordinary, and they're using it wrong, because sometimes, like if you mix certain ingredients, and this is like, I think it's common knowledge, but I guess it's not. So for example, even if you're ingesting vitamin C and zinc, that reduces absorption, right? So it counteracts each other. So, and this is one of the reasons why I don't really overall like leave on acids, because when you do that, it can break down or reduce the amount of performance that the polypeptides, the aminopeptides, can work in your skin. So, you know, people are hearing from YouTube and social media that this is good and this is good and this is good, and they all can be good, but it's the combination, how you're using it, what your skin type is. And because when they hear the benefits, I had one client, and if she's watching it, I'm sorry, but she was using 7 different serums, layering them on, and she started to develop dermatitis all over, and she couldn't understand why, and I had to take her off all of those and then start over. So you have to, it just depends on the person, because when everyone hears that, you know, niacinimide is great, or vitamin C is good, or alpha-arbutin is good, these are all great products for specific types of skin. So it just depends, and what you're using it with. You have acne at 68, most on the cheeks and jawline. They never go away completely, and it leaves scars. Pimples are flesh colored, matches my skin, but they never go away, and I use cream for derm. What kind of lotions do you? Okay, so if the pimples are flesh colored, you need to use glycolic acid and something like a scrub or something you can rinse off. How do you? Well, bruises have nothing to do with scarring, but if you have hyperpigmentation from acne, you need to exfoliate every day and then use lighteners in there. And so I would look at sunscreens that actually have leave-on lighteners for the skin. Redness around the nose and mouth. I'd have to look to see, is it like a rash? It could be like, is it perioral dermatitis? Is it rosacea? I'm using E45 cream. I mean, these are all like waxy substances, and this is not going to, according to this, it's not going to increase hydration in your skin, but it has a lot of emollients and occlusive agents. So is this like clogging your pores? Is that what you mean? Well, I don't understand any of the things that this can help your skin at all, unless you have like a burn or that you need to heal your skin. So you have a recommendation for a good rich moisturizer for the face. Okay, so here is something that depends on your skin type, because a rich moisturizer for someone who has aging skin is going to be completely different for somebody who has combination skin. Oh, Keratosis Pilaris. So here's one thing that you can do with Keratosis Pilaris. If you have it on the back of your arms or the back of your legs, you need to exfoliate for sure regularly with that. And that is Keratosis Pilaris. That is something that you can use if it's on the back of your arms and your legs. It can tolerate a leave-on exfoliant, as well as getting a little bit of UV rays without sunscreen for about 10 minutes, because that UV ray can penetrate deeper into the skin and help control that. Melasma treatment. So do you mean at home, or do you mean in the, you guys have to be more specific. Acid peels. Okay, so depending on your skin, hopefully the person that you're going to take a look at can evaluate your skin. I don't ever recommend right off the bat, unless you've had a skin history, that you can do this, is you can do glycolic acid peels mixed, or you can even start to be more gentle, like a lactic acid combination of kojic acid, because lactic acid is the most mildest and one of the larger molecules, so it doesn't penetrate the skin as quickly. And then when you pair it with kojic acid, it's lighter. Then you can actually work your way into layering, where you use the glycolic acid first, because then it breaks down the intercellular cement faster, and then you can layer that on top with a lactic acid and a kojic acid peel. I do not recommend doing this at home unless you're trained in these acid peels. I've had throughout the years people who purchase this stuff online, didn't even know what the percentages were, and then it burned their skin, and now they have hyperpigmentation from the burns. So you do have to be careful, okay? Is Cetaphil dermacontrol with SPF 30 okay for oily, acne-prone skin? I'd have to take a look at the ingredients to see. Linda, you can go on to Go See Christy, Christy. I don't even know where to look. Go See Christy Beauty, and then you can click on online consultation, and it tells you step by step if you're the right client. I don't take everyone. So the clients that tend to get bored easily with their skincare, jump around, do not listen to my instructions. Those are the people that I do not want, because then you're not going to get the results that you need. If you are someone who has a skin condition and you want results like that, like immediate, I am not your person, because I have to understand your skin's history and what you eat. So there is a specific clientele that I do work with, and they do get results, but it's not overnight. And it takes a little bit longer, I notice, with video consultations versus in person, because obviously I can look at their skin, I can do a dehydration test, I had a machine that you can do. So treatment for stretch marks. Well, okay, yes and no. So stretch marks are basically irregular striations of the collagen and elastin. And if the collagen and elastin has stretched really quickly, then there can be some hyperpigmentation and some redness. And if you exfoliate that regularly over time, and then you do use some body lotions that have tyrosinase inhibitors, it can help. But they stretched so fast, faster than the skin can stretch. So that does take time, okay? And the more irregular the striations are, the longer it takes. But if you're expecting the striations to be completely the same structure as my skin, or your regular skin, then it doesn't really, it can't be, because the striations are completely different. Post-inflammatory hyperpigmentation. So if you're talking about acne scars that are like the pock marks, that you have to do with a series of microdermabrasion and exfoliation. But if you are, if it's like the scarring, that you can do, and you have to do, I found that you have to do that like layering with certain lighteners. So at my practice, I didn't really use hydroquinone, even though I had access to hydroquinone. And the reason why I didn't do hydroquinone is because there's other things that you can use over time. Okay. Yes, actually, so I don't like Clarisonic. I don't like those exfoliating brushes because they're just so dirty, and especially my clients who had acne would use it, and the acne would actually spread. So I do recommend some of the machines. Like I started to use, maybe I should take a picture. So I do use one of the MyoLift. I used it actually last night because I actually started to see some sagging, and then at night when I was sleeping, like you could feel your skin like tingling. So, and you know that video that I did on the skin tightening, that actually did start working on my neck. So let's see, how do I get rid of my forehead acne? Okay, so here's a question. Are they flesh colored bumps? Are they red bumps with pus? Do you have cystic bumps or red bumps with no pus? Because typically, and again, I don't know what you're using, because I'd have to see a picture of it, or you can do the red bumps with pus, then you need benzoyl peroxide or salicylic acid. So you have to red with, oh, what did I say? Red with no bumps. What do you mean red with no bumps? Aren't they bumpy if they're acne? You don't use any products? So do you even wash your face? If you're getting bumps or, breakouts on just your forehead, it could be that the oils from your scalp, because the oils from our scalp typically tend to be a little bit thicker. That's because it needs to get on the hair. If it's coming down, that it could be that. Again, I don't know what your lifestyle is, but if you use a slightly acidic cleanser, and then you use an exfoliating product where you can rinse off and then do a spot treatment. Okay, maca, South Africa. Okay, so I do them literally all over the world. So you can look at what I would do first is I would go online and check to see the time difference between Pacific Standard Time, because I'm in California, and then what time is it in South Africa. And usually I try to do mine. There's a series of consultations, and one of them is during the day where I have to look at the texture of your skin. Okay, so it has to be in good light. So you have to look at the time where you're in natural daylight, and then see what time it is and see if that is realistic. Skin color, tiny bumps on overall face. Okay, so if you're using an AHA BHA cleanser, okay, obviously you're rinsing that off. That is not going to do enough. You're going to have to use an AHA BHA exfoliating scrub on that. And I'll go back and I will answer them and put links for some products. Okay? Scars for our darker skin tone. Okay, do you know by chance if you, what's your name? TXOXO. If you, okay, do you know what Fitzpatrick type you are? Because if you, that would help. If the darker your skin is, obviously the more pigmentation you can make and the faster, and it's more stubborn. So the thing with my darker skin type clients, I have to work slower with them. I'm like upfront with them, because when you reduce inflammation, then the hyperpigmentation can get lighter. Okay. Oh, Tretionin L Ascorbic Acid, that is effective for hyper. Oh, that's a good, nice person 58. Oh, what a nice name. Okay, so this depends on the person. I have found, because I've literally have treated thousands of clients, some people work with tretinoin, other people L ascorbic acid. So for example, for me, I am doing a follow-up with the SkinCeuticals CE ferulic acid. That's the L ascorbic one. I didn't see too much of a difference. So, and it also depends on how you use it too. Okay, so it just depends on your skin type. I think with lighter skin though, and depending on how dark the hyperpigmentation is, I would probably use, you're going to have to go a little bit invasive if your skin is fair. I think L-ascorbic acid, you can actually use a combination of both, alternating. So do I use an acidic face wash and normal moisturizer? Normal moisturizer. Well, if your skin is oily, you might need a lighter moisturizer or a gel-based, like water-based moisturizer. What do I put on my skin after microneedling? What are you putting on there? Is it a water-based serum? I came across somebody who was microneedling with a cream. Do not do that. So you want to use something that's anti-inflammatory. I always recommend a gel, like a Rosacom serum that reduces inflammation, introduces glycosaminoglycans and beta-glucans into your skin. Niacinimide breaks me out. Why is that? Isn't it supposed to help fight acne? Okay, so see, here's a great example. Some of these products that say that helps with breakouts, it can help, break people out. So if it breaks you out, obviously don't. Oh, you're welcome. Obviously, if you are breaking out, you want to use something else. Can retinoic acid peels be more effective than glycolic acid peels? I mean, 2% tretinoin. Okay, so do you mean a glycolic acid peel that you put on and then leave on for a few minutes and then rinse off? Or do you mean like a tretinoin type of a cream? And that depends. They both are pretty strong. That depends on your skin type and if you exfoliated before you did that and what products that you're using. Sources of energy: bipolar radio frequency, energy, LED light energy. Okay, so what are you using it for? Used it for skin tightening. Oh, okay. So you have to be careful if you have prone to hyperpigmentation. Well, okay, so it really did make a difference on my skin. However, I stopped it because I'm using this other skincare protocol to see if it's working, because I want to report back to all you guys if it actually is working before you spend the money on these products. Okay, if you're using a Retin A and not like retinol, yes, I think you should use humectants, because any type of retinoids is going to increase your skin cell turnover rate, and you are more prone to TUL, which is transepidermal water loss. And so what that means is it's increasing the skin cell turnover so quickly that your skin has a hard time holding onto moisture. So then, of course, it starts to peel and crack. So humectants work, but also you need some emollients as well, because you're not only stripping moisture, you can be stripping away the fatty acids, okay? I mean ascorbic acid. I'm using it as 30% to reduce my dark spots. However, my skin starts to crack and dry out. Should I continue using ascorbic acid? Is that high in percentage? Okay, so that means that the acidity is too high for you. Is this a serum, and what type of cleanser are you using before that? And then after the ascorbic acid, what are you doing? Because that will tell me a lot. I use the radio frequency to treat early wrinkles and face sagging. It has immediate effect, but once stopped, my face sagged more. Well, Ross, I would have to take a look and see. Because that is, I don't know, once stopped. Do you mean like several weeks before, or what does that mean? Because it does stimulate collagen and elastin production, but I'd have to, can you give me a little bit more detail on that one? Osmosis products. You know what? Actually, they are, I know they're a better company than most, but, you know what? They're kind of high price for the results that I got. So it's not that it's a bad, they have actually really good ingredients in that, but, I don't know. It was okay. My mom is breaking out in rashes lately. Could high fragrance be causing this? She has a history of eczema, but it's never been this bad. Okay, where is the eczema? And that makes a difference. Like, is it on her face? Is it under her arm? Is it on her feet? Yeah, high fragrance could be doing it. Also, if it's an, is she using products that have higher amount of solvents in there? Sodium benzoate, which is used commonly in skincare, which is used as a like a preservative. Sometimes it can cause flare-ups. CeraVe moisturizer cream for this winter and CeraVe PM lotion. That's better for people who have alopecia skin. It can break out people who tend to have oily skin or combination skin. Expensive sunscreens often contain a bunch of antioxidants. Are they really working, since sunscreens are meant to stay on the surface of the skin? Not okay. So if it has antioxidants, if you look in there, if they're using peptides also, if it says peptides, that is a way of delivery system, delivering that into the skin. So it depends on the formulation, obviously. Okay. Non-chemical sunscreen for dark skin. I have a lot of acne marks as well. Zinc oxide and titanium dioxide, especially zinc oxide, is anti-inflammatory. And I will answer later in the comments of some sunscreens that you can use on your skin. The challenge with dark skin, obviously, is zinc oxide. A lot of the zinc oxide can create this like white sheen on your face, and then some people don't want to use the nanoparticle zinc oxide, which is more, you know, see-through, doesn't create that white sheen. But there are some that you can use that are not nanoparticles and more tends to be more sheer, so that can be an issue, because zinc oxide and titanium dioxide are the most common mineral, obviously, for sun protection. And the darker skin, you know, they don't want to be going around looking like Casper the Ghost. I haven't found an eye cream to work other than having Botox twice a year. Okay, so is it more for lifting, or is it for fine lines and wrinkles, or for both? Because so Botox basically, as you know, freezes the muscle, right? That and it's like lifting. So when your skin is creasing over and over, it's because there's a breakdown of collagen and elastin. So yes, there's nothing that really can like lift. Now there are some creams and everything that say like lift, and at some level it does a little bit, but if you have fine lines and wrinkles or sagginess, there is nothing that actually will create a lift. And that's why I'm doing my MyoLift machine again, because that, based on my experience and using it on my clients, that is the only visible thing where I've seen, because I'm starting to sag up here, so I'm using that on my face. No, I don't recommend the Ordinary's AHA BHA peeling solution, not because that it's a bad product, it's not, but because there's so many people that are using it incorrectly. And so now I have I have these young people who are starting to do fine lines and wrinkles, where 10 years ago, never saw that. So some people are they're over exfoliating and under put they're not putting enough protection on their skin. So overall, generally speaking, I don't recommend it for a lot of people, not because it's a bad product, but because people are using it incorrectly. Right now I have super dry skin. What's the best serum? Okay, so Marianne, you're in Tucson. Okay, if you have dry skin, hyaluronic acid is probably not enough for you because it's going to pull that hydration from your skin because it's so dry in Tucson. So look for something that has polyglutamic acid on there, and that creates a hydration shield over. So, and then if you can use a toner that also has that, that's really going to help with the serum. Can you please tell me retinol serums and creams that is easily available online in Asia and Gulf countries? I don't know. I'd have to look. You know what, Garima? The best thing that you can do is in the comments later, put some links on there of, I don't know if you can put links on there. Sometimes YouTube doesn't like that. They end up in my spam and then I forget to check my spam. But, and then that way I can look it up and look at the ingredients for you to see if they are good. Thoughts on mineral oil and skincare? Not a big fan because it can, not that it will, but it can cause some breakouts because it is an occlusive agent. However, it's inert. It's not it's very stable, it doesn't spoil, so it can be used for people who like to heal burns, but overall I have noticed that people who are breakout prone or they have a slower desquamation rate, they tend to get like clogged pores. No, I've never been to Korea for skin treatments or products. What is my personal favorite? I keep talking about it, and that's only because I've used so many different ones. I keep going back to it, and that's the Lyra Clinical, and I use the hydrating one. And because I have hyperpigmentation. It's a moisturizer, it has peptides, and it has antioxidants all in one. So that's why I like it. Good for you. You're eating raspberries. Very good. I told her to eat raspberries because raspberries have ellagic acid and it also has brightening agents in it. So the Lyra Clinical also has raspberry extract in there. So, hollow under eye, would Botox or filler help? Okay, so I don't give specific recommendations for that because number one, I'm not a plastic surgeon, and number two, I don't administer fillers. What I would do is if it's really bothering you, then I would go see someone for a consultation. I always tell people no matter who you go to for, when it's like invasive procedures, whether it's plastic surgery or fillers or whatever, go to the consultation, wait 24 hours to see if this is something that you want to do. And if it is, then make the appointment. I've had clients before where they felt pressured by saying this doctor is full, you can't get an appointment for the next 6 months to a year, so if you want to do it, you got to do it today. Do not fall for that. Wait. Really think about it and see if this is something that you want to do. That's what I would recommend, because if it's really bothering you, and I would go see several different consultations and see what they tell you, and what the cost is and how long it lasts and what the contraindications may be, what are the downsides to it, because anytime you're injecting stuff in your skin, you don't know what's really happening. I mean, obviously if you're injecting yourself with the hyaluronic acid, I think that just gets reabsorbed, but I would get different opinions first before doing something like that. See if there's actually a underlying cause of why you have that. Maybe you have allergies, and because of the drainage problem over time, that's what happened. And maybe, again, I don't know, you have to see your doctor. There's an underlying cause, and then if you can address that, then that will fix itself. And then if it doesn't, then you can go see someone. What about a good moisturizer for like day and night? So that's what I'm saying, Marianne. So I would use the Lyra Hydrating Sunscreen, the moisturizer, because it is already a moisturizer with a sunscreen. At nighttime, I would have to take a look at your skin to see, because like I said before with that other person, a good moisturizer for someone who has oily breakout prone is going to be completely different than someone who has aging skin. Okay? That. Okay, so oh boy, Jonatil, I hope I said it right. Hi, okay, so whether you're using hydroquinone or any type of lightener, hyperpigmentation can come back, and that's what's really frustrating. And this is why you can use hydroquinone, but over long term, I just don't think that that's like healthy. So when someone is using something for hyperpigmentation, I try to be upfront with all of you that it can come back. So the best thing to do is to not form the hyperpigmentation in the first place. Now, one of the things that I do, because I have very bad hyperpigmentation and I'm not a big proponent on drugs, is I eat a berry mix in my smoothie along with some antioxidants, because it's from the cellular level, right? When you eat foods, the foods break down and your body uses it to create, you know, more protein or amino acids or, you know, whatever, renewing all of the thousands or millions, I guess, of cells. So I do both of that and skincare. So I hope that helps with that. So if any of you are buying a certain cream to address hyperpigmentation and thinking it'll never come back, it can come back. So the ones that do fade over time and may not come back are like the surface level acne scars, or, you know, surface level, you know, injuries that you have, like a cut or something like that. What cleanser or acne products for oily, sensitive, and acne prone skin? What products to reduce post-inflammatory hyperpigmentation? Ingredients recommendations, not too harsh, please, thanks. Here's another thing I've learned treating with lots and lots of clients is that when people tell me sensitive skin, I have to look at their skin and ask them a lot more questions, because sometimes people are they're sensitizing their own skin, but it's not a clinical definition of sensitive skin. So, Fala, do you have fair skin? When you use products, are you prone to redness by a lot of products? Does your skin react? Is it very reactive? Because if it's not, then the sensitization could, not that it is, but could be sensitizing your skin, and that's where we normalize the pH. Okay, so if you are prone to sensitive skin, then you may want to stay away from glycolic acid, sometimes benzoyl peroxide. If you have post-inflammatory hyperpigmentation, you definitely should not be using any leave-on exfoliants like the ordinary AHA or BHA solution. Again, I don't want to get all these people telling that I'm negative about that, but for sensitive skin, not the greatest thing for that. Okay? You're welcome. Is glycolic acid really bad? No, it's not. Okay, so it's not bad. It's not bad. It just depends on your skin type. You know, it's like, is Retin A bad? No. So everyone wants to like side on the extremes. It just depends on the person's skin. Is 20% niacinamide more effective than 2 to 5% niacinamide? Because 2 to 5 is the most evidence-based concentration niacinamide. Okay, so it's not necessarily just the percentages. Obviously, when people hear percentages, they think the higher the percentage, the stronger it is. It's what else is in there. What is the delivery system? So it's not necessarily just because a percentage is higher that it's better for your skin. Clindamycin help with acne and clogged comedones. Well, clindamycin is an antibacterial, so it's basically killing the bad bacteria that causes the acne. But if it's clogged comedones, that has nothing to do with bacteria. That has more to do with the oil being clogged from dead skin cells, which all you need to do is exfoliate. So I don't recommend antibiotics right off the bat. I always want to look at their skin, and the reason why is because when you use oral antibiotic, I'm not talking about the topical, but the oral, like clindamycin, you know, you can put that on. But like if you're like taking an oral antibiotic, you're also killing the millions of good bacteria in your gut just to address bad bacteria, which a lot of times you can just do with the right pH. Not everybody. Some people do actually need, you know, an antibiotic or Accutane or something like that. So it just depends, okay? What helps with reducing the appearance of necklines? Keto B. Okay, so I am using that high frequency one, and that really has helped. I mean, it is amazing how much it really has helped. Now, I don't know what the effects are yet because I stopped using it to use this other protocol by SkinCeuticals, so we will see, and I will do a video on that. Any electric at-home face devices like high frequency LED for acne specifically. Okay, so acne. So typically they say blue light helps with acne, but again, it depends on what the acne looks like. I'd have to look at it, what the diet is, because sometimes you can just help it with diet, because this is what I've learned. If you go in for blue light treatments or you're doing them yourself and you keep and it's diet induced, well, it's not really going to help, right? It's counterintuitive because if you're not changing your diet and you keep doing the blue light and you're like, I'm not seeing any results, it could be because of diet. So Cecile, I hope I said it right, Cecile, I'm not sure because I don't know like what your diet is, but to answer your question, like generally speaking, yes, it can help. Sensitive skin perfect for humectant and emollients? Yes, but it can break out some people, Nick. So, yes, that works for a lot of sensitive people, but make sure if you're prone to like bumpy skin, you need to exfoliate because any type of humectants and emollients and occlusives can break out the skin because it can clog the skin. Chemical exfoliant for sensitive reactive skin. Okay, so Anna, uh, again, I don't see your skin, but typically lactic acid is an AHA, and molecule-wise, it's one of the larger ones, so it doesn't penetrate the skin as quickly, and it is hydrating, so that tends to be better for sensitive skin. Generally speaking, if you have blackheads, if you do a combination of lactic acid and salicylic acid, that tends to help as well. Do coconut oil and Vaseline clog pores? It can, not that it will, but coconut oil is a heavier fatty acid, you know, chain molecule. So it tends to be heavier, so it can clog the pores, not that it will. And Vaseline is an occlusive agent. It's basically a byproduct of petroleum. So when they process petroleum, that's what's left over. So that's what they use. That's why it's so cheap. It doesn't have any ingredients that is beneficial for the skin per se, but it can help heal the skin of like burn patients. That's what they use, Vaseline. Okay, because it's basically laying on top of the skin. Needling or microneedling for stubborn melasma, and what serums can be used. Okay, Garima, if you have I'd have to look at your Fitzpatrick and how prone you are to melasma, because microneedling can actually make it worse for some people. Not that microneedling overall is bad, it just depends. But what I have seen is the darker you are with microneedling, the more prone that the hyperpigmentation can come back. I feel hyaluronic overshadows it a little bit. Yes, glycerin, it works the same as hyaluronic acid. However, some people break out more with hyaluronic acid, and some people break out with some people break out more with glycerin because of what it's used with, and some people break out with hyaluronic acid. It just depends on what it's paired with ingredients wise and where you live. Do you think sunscreen contains zinc oxide and some chemical? So that's a combination sunscreen. So there's three types of sunscreen. There's physical, chemical, and combination. So physical is where it stays on top of the skin and it creates a physical shield from the UV rays, so it literally just bounces off. Chemical actually absorbs the UV rays and then shatters it or breaks it down within the skin, which is why chemical sunscreens have to, you have to put it on and then you have to wait 30 minutes for it to get absorbed into the skin. So basically when it's a combination, it does both. And so if you're not somebody who likes chemical sunscreens, but you're going to be playing volleyball and you're going to be sweating a lot, then a physical sunscreen can't really help, right? Because you're literally wiping it off when you sweat. So that could be a combination one or a chemical one, and you're not sensitive to it when you're sweating a lot outdoors. That's when it can help. But on a daily basis, when you're just getting sun protection, you're just going from your car, driving to work, or just doing daily things, then I think help, like over long term, I think a physical sunscreen will suffice. I want to drink health skin because I've gone years dehydrated, so I am avoiding chemical exfoliating. I hear that after cleansing, you can physically wash your face with a rag to remove dead skin. Well, you can, but you're like dragging the skin, and that is a form of physical exfoliation. But the one thing with that, unless you use a chemical exfoliant and then you do that, is that does not break the inner cell, that doesn't break down the intercellular cement, which you need a smaller molecule to break that down. Physical, what that does is it breaks apart the individual skin cells, but it does not break apart the intercellular cement that holds the dead skin cells together. Any advice to prepare for prevent post-pill acne? Planning on going off soon and I'm scared. There is an adjustment period, and that is going to be hormonally driven, which hormones affect the pH of the sebum, which you may be going back and forth between some ingredients. Why with some of my clients, they you have to go back and forth, and that could be cleanser and it could be moisturizer. So yeah, that there is that, not that it is, but it can be an adjustment period, especially if you are if your acne is more hormonally driven. CeraVe has a moisturizing cream for rough and bumpy skin, and it has salicylic acid. Yes, but it doesn't work as well. That works better, I think. I have found with clients is it works better. They said it tends to work with Keratosis Pilaris, but not really for their skin. But again, some people, it might work for their skin. So, does moisturize with SPF help protect from UV rays just like sunscreen products? Yes. Yes, it just basically has moisturizing properties in the sunscreen. It just has more in there. So if you look in there, actually, well, I'm not going to say because I've looked at so many of them, but basically the difference is it'll have more humectants in there and more hydrating properties in there. Okay, so Garima, I'll see you later, and I will look on my Instagram, but I do have several consultations all the way until evening, so I'll try to get to them in between my appointments, but I got to go over my paperwork, okay? So Chocolate Fudge, see you again. You're welcome, Nick. I'll talk to you guys all later. Okay, so if you have any questions, you can look on that. And Nicole, it's a little bit late. I'm so sorry. We're ending it because I really have to get to my consultation. So I will talk to you guys soon. Okay, bye.